I want to thank Barbara and IOM for the chance to be here today. This is my very first time in this fantastic setting. It's just a wonderful place, and I don't have any slides. I once produced a PowerPoint, and I presented it to the President of the United States, and there was a mistake in it. He threw me out of the Roosevelt room, and I gave it up for life. So I'm just going to talk to you. Let me reveal my biases at the outset. I'm a former CBO director, and that means that you end up learning something about health policy, if nothing else, because the numbers drive you there. And so for about 15 years, I've been thinking about these issues, and I have always believed that there's a future in which there's a convergence of healthcare services, long-term care services, and other things delivered in the home, supported by some technologies that we probably don't even have the ability to imagine right now. And I've tried to keep track of the evolution as a result of the home health world as a hobby, if nothing else. And so I'm pleased to have a chance to talk about it today. Unfortunately, the initial part is going to be about sort of the financial condition of various aspects of the country and home health. And this is a terribly depressing discussion. So have a drink and hang on, and then we'll move on to other things. First, I cannot emphasize enough the basic budgetary problems facing the United States. And, I've been saying the same thing since 2003. I will say it again to you, which is we are on a fundamentally unsustainable trajectory, even with the good news we've had about the pace of healthcare spending in recent years. That basic picture is this one. This year and next year we'll have slightly declining deficits, and then every year after that, the numbers go north. We get larger deficits up to $1 trillion within the 10-year window. We see the $7 trillion of additional deficits over the next 10 years. We see the debt exploding even relative to the GDP of the United States. And these are projections that have baked into them some continued improvement in the pace of healthcare spending per person. We've seen that come and go in the past. We've got 4 great years in the late 90s, and it went away. We've had some good years recently. It could go away. It has baked into it relatively low interest rates by historic standards. Despite that, interest payments at the end of 10 years are a bigger part of the budget than the Pentagon, and they are, in fact, the second largest component of the budget if we get higher interest rates. And so it is important to just recognize that it is going to be a tight money environment. No matter how you want to characterize it, apocalyptic or manageable or somewhere in between, it's going to be a tight money environment. There's no way around that. And the programs that are central to paying 80% of the home health bills, Medicare and Medicaid, as the slide showed, are at the center of those difficulties. Right now, Medicare has a gap between payroll taxes and premiums going in, payments going out of $300 billion a year. It's a third of those $1 trillion deficits we heard so much about all by itself. We're getting 10,000 new beneficiaries every day. And this is a program that's going to be under increasing financial pressure. And how that pressure gets managed is going to be crucial to the future of home health. Medicaid, anyone who's looked at a state budget knows how important Medicaid is and the pressure it's under, increasingly grabbing larger shares of state resources. So these are environments in which the main payers, those paying 80% of the bills, are really going to be under a lot of pressure. And it's already showing up in home health. I worry about the financial condition of the industry itself. CMS has done rebasing and proposed some cuts for the industry that look to have had significant impacts. Their own numbers suggest that a couple years out, 40% of the home health providers are underwater. The Department of Labor issued a final rule last September that mandated overtime pay for a lot of the workers in the industry that previously weren't going to get overtime. So you've got financial pressures for the nation as a whole, you have financial pressures on the key payer programs, and you have a lot of financial pressures on home health itself. And so that drives what I think are the real key questions of home health as an opportunity. To what extent can it contribute to solving those problems, and to what extent can it contribute to solving those problems with high quality care? And on that front, there are some real opportunities, I believe. There's lots of evidence that the best thing you can do with these frail, increasingly ill with chronic diseases and disabilities, keep them out of acute care and thus save a lot of money. So the opportunity at the front end to really solve the Medicare cost problem is a serious one. And we've seen in some research that post-acute care, home health has a role. And there's some legislation on the Hill right now where if you look at putting a post-acute care stay in the appropriate setting, whether it's a SNF or at home or a nursing home, and doing it in a cost-efficient fashion, you can save money. And some reforms in the Medicare program could actually deliver that opportunity, I think, in the near term. And there's a lot more of that. But I think for the home health world to take advantage of it, you're going to have to document the cost savings, but also document the quality. And that in other parts of the healthcare sector has been an ongoing effort that's far more mature than it is in home health. There's a relatively few programs like, the Medicare Advantage STARS program, whether you like it or not, it's there. It identifies high quality MA plans and providers. Something like that is going to have to grow up in the home health world so that you've got a quality stamp to go with your cost, and the value proposition is presented to the policymakers and the taxpayers. I mean, that is in the end incumbent upon everyone in the healthcare world now and going forward. And I think those are key things that are going to be very, very important. So, I mean, that's the top line thing I wanted to say. And now I want to just sort of reinforce a couple things that Tricia covered that I think get underappreciated in terms of the pursuit of that. And the first is this whole issue of the multiple silos problem. And, we've got a big silo between healthcare services and long-term care services. And the long-term care piece is very important for the future. Traditionally, long-term care has been provided by families, usually daughters, and going forward, as we have increasing needs for this donated care by daughters, they're going to be working. I mean, the labor force dynamics are unmistakable. That's just not going to add up. So someone is going to have to provide these services and do it in a market-based fashion. And getting rid of the silos, I think, is going to be an important part of getting the payment incentives right and getting the financing of home health done in an efficient fashion. So the silo issue there, I think, is crucial for the industry going forward. It's also true that we have these silos between Medicaid and Medicare, and they don't interact very well. And breaking down some of those silos, I think, is going to be important. The other silo that comes up all the time is, what's the delivery model? Is it going to be a fee-for-service model? Is it going to be some sort of integrated care like we've seen some experiments? Those are big issues that I just don't think that the policymakers really have on their radar screen. They're trying to fix these programs at the margin, try to keep the costs under control, but there's going to, I believe, has to be a fundamental rethinking of how we deliver all these services and break down some of these silos. And that's going to be a very big challenge, given that the budget's going to be a mess and the boomers are already retiring, and so that they're going to be afraid to make changes, and they're going to want to go with comfortable proposals, and I'm not sure that'll be enough to get this right going forward. The other thing I would flag is, I really do believe that the history indicates very clearly that innovation and technological innovation is at the core of solving our major policy problems. Whether it's health or education or climate, whatever it might be, that's where the solutions come from. And in this world, it's not very clear what's going to be the mechanism for solving two big problems. One is, who's going to take care of licensing and improving devices, right? Your cell phone was a pretty simple thing, but the smartphone has a lot of applications, some of which are health applications. In fact, if you upgrade your iPhone to the new operating system, there's this big health app sitting there. So is the FDA going to run that, or is the FCC going to run that? And no one knows right now. And what will be the efficient path for finding these integrated devices that help you out in delivering services, whether it's just through communications or whether it's through actual detection and remote sensing? I think it's an important issue. It's also true that we remain in the U.S. Bound by state-based licensing and state-based scope of practice and state-based approaches to things. And in a world where the best provider might be right across the state line or via telehealth or something like that, that gets in the way of delivering efficient care. And so we've got some approval silos, we've got payment silos, and I think the key for the future is trying to imagine ways to break those down and get efficiency in the delivery of this care, whether it is healthcare or long-term care, into the home. And that, I think, is the primary challenge. I don't think you can overemphasize the importance of this. The pace of healthcare spending in the U.S. is our fundamental domestic policy challenge, period. The debt has been identified by Admiral Mullen as our #1 national security threat, and the debt is a reflection of our healthcare spending. And so my belief is if there's sufficient imagination and a rethinking of these siloed approaches to approvals and programs, we can take on these dual problems in one fell swoop. And other than that, there's no pressure on you. I mean, and so I'm going to follow the lead of a smarter woman than I am and say, come up with some good answers. Thank you for letting me join.